3. Must know COVID effects on the heart. Hello everyone, I'm Yuan and welcome to my channel on Dr. Yuan Explains, where I'll provide simple, fun and reliable medical knowledge for everyone. The information for this video on increased cardiovascular disease cases in COVID patients is obtained from the recent Nature Medicine and JAMA paper published in February and March 2022. These are the top medical papers. The results, they recorded 153,000 plus individuals who got COVID from the US Veteran Health Administration database and compared to another two sets of 5 million plus individuals without COVID. So the first must-know information is that in 1,000 people who got COVID, there is an extra 45 people who developed any heart disease. This can be seen from the graph on the last bar for any cardiovascular outcomes. And on the top, we can see that it covers all types of heart diseases, such as heart attack, heart failure, stroke, and angina. The second must-know information is that in 1,000 people who got COVID, there's an extra 23 people who developed MACE. So MACE refers to the major adverse cardiovascular events that includes all the incidents of heart attacks and stroke on its mortality and hospitalization for heart failure. The third must-know information is that the most common heart disease developed is dysrhythmia, which actually refers to all the irregular heartbeat diseases, like if it can be too fast, too slow, or with an irregular tempo. Disease such as atrial fibrillation and sinus tachycardia falls into this category. So if you use the cha-cha dance as an example, so if the normal rhythm should be boom chap chap boom chap chap, so if it's too fast it'll be boom chap chap boom chap chap boom chap chap. If it's too slow it'll be boom cha cha boom cha cha, and if it's irregular it can be boom cha cha boom boom cha. So similar for the heartbeat, it can be lup dup, but it can be too fast, like lup dup 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 dup, and it may be irregular, like lup dup dup lup dup dup. It is hypothesized that the COVID virus infection leads to continued activation of the immune, inflammatory, procoagulant cascade, but more studies are required to confirm this. So a very simplified explanation of this theory is that the virus triggers inflammation, which then initiates the clotting. So excess inflammation and clotting mechanism activation leads to the progressive development of these cardiovascular diseases. So last but not least is the take-home message of the paper. So what do you think? Is the increase in cardiovascular cases a lot for you? So nevertheless, this paper is also a good reminder for all of us that for elderly people above 55 years old, especially those with other healthcare conditions such as hypertension, type 2 diabetes, and high cholesterol, with a strong history of cardiovascular disease, need to keep an eye on their cardiac health. For those ex-COVID friends, we need to be more alert on the signs and symptoms of cardiovascular disease, such as chest pain or discomfort or any palpitation. If there's any doubt, just quickly do a cardiac checkup. Don't delay. So another point to share that the early symptoms of heart attack, such as chest pain and discomfort, can possibly be felt as pressure squeezing, burning, or fullness sensation. So it's actually an indication that the heart is running low in oxygen when the cardiac cells are trying their very best to survive. So the pain or discomfort is actually a way that our heart is screaming for help and immediate attention. These symptoms may be mild and inconsistent, but if it persists longer for a few hours, it's good to have a quick check at the hospital. So if you're healthy but at a retired age, it's always good to do a stress test every 2 to 3 years for any early detection. During the stress test, we need to run on the treadmill and to monitor the heart signals of ECG. So exercise is also an example of exertion, and any minor or early signs of abnormalities in the ECG can be revealed. This is because some blockage of the heart vessels are minor and they can still function properly to channel sufficient blood supply when we carry out our normal daily activities. However, during exertion or strenuous activities such as exercise, the blood supply through the narrowed blood vessels may not be sufficient, causing injury to heart cells or even cell death. Don't worry if the stress test sounds scary in a way. It's done under strict medical supervision, and the cardiologist will interpret the ECG for further ordering of tests for further investigation. So if you're interested for more videos on cardiovascular disease, do comment and let me know too, then I can film accordingly. Thank you for watching, and I hope that the video is useful for you. You're more than welcome to share the video and subscribe the channel for further video updates. Have a good day.